Hello, my name is Adeline Roseby, and today we're going to be talking about tDCS treatment and chronic pain. In this presentation, we're going to be looking at how does tDCS treatment work, its theoretical and practical frameworks, as well as potential future research needed. So what exactly is tDCS? The official definition of tDCS is transcranial direct current stimulation. How it works and its functions is done by delivering a non-invasive brain stimulation technique that uses a lower electrical current to help in modulating neuronal activity on the brain through specific areas on the scalp. The goal of tDCS is to modulate neuronal activity through either enhancing or inhibiting brain function that depends on the polarity of the current applied. This method is gaining attention in both research and clinical settings for its potential therapeutic applications. Its intentions can be used to help in chronic pain, as well as autism spectrum disorder, schizophrenia, and major depressive disorder. We're going to be looking at chronic pain, so to look at chronic pain, we're going to have to define it. The definition of chronic pain using the Hopkins medical definition is the persistent, long-standing pain that persists beyond the usual expected recovery period or occurs with a chronic health condition. Typically, chronic pain will be managed with over-the-counter medicines, prescription pain medicines, physical or occupational therapy, and injection therapies. Chronic pain is typically associated with the changes and alterations in neuronal circuits, which then leads to increased excitability in pain pathways. It also enhances responsiveness of neurons in the central nervous system that leads to heightened pain perception. Mechanisms of tDCS would include using both anodal stimulation, which increases neuronal excitability, typically applied over the motor cortex to facilitate pain modulation, and cathedral stimulation, which works by decreasing excitability that's often used to inhibit the more overactive pain pathways. The current method of tDCS in practice is delivered by a low electrical current between 1 to 2 milliamps on a specific brain region needed, continuously ranging from 10 to 30 minutes. The design of the machine is made to be well tolerated for the patient and as minimizing as possible to discomfort. A case study done by Fregni et al. Titled The Effects of Transcranial Direct Current Stimulation on Chronic Pain, a case study, looked at exploring the applications of tDCS as well as the methodology that's employed in the technique. The patient for this treatment was a 45-year-old woman that suffered from chronic pain resulting from fibromyalgia. The anode was placed over the primary motor cortex, the C3 position on the scalp, while the catheter was positioned over the contralateral suborbital area, the FP2 position. Pain intensity was assessed using a visual analog scale, VAS for short, before and after each session. A VAS was also conducted at follow-up appointments, and the study was evaluated improvements in the patient's overall functionality and quality of life through standardized questionnaires. The results demonstrated a significant reduction in pain intensity and an improved daily functioning following the treatment sessions, supporting the efficacy of tDCS in managing chronic pain. tDCS in chronic pain. Transcranial direct current stimulation primarily targets the motor cortex and the dorsolateral prefrontal cortex to modulate pain perception and emotional regulation in chronic pain management. This area is involved in the processing of motor functions, which can be affected in individuals with chronic pain conditions. By stimulating the motor cortex, tDCS can enhance the brain's ability to modulate pain signals, potentially decreasing the perception of pain. tDCS may promote changes in synaptic strength, leading to neuroplastic adaptations that help the brain better cope with pain by influencing both ascending and descending pain pathways. tDCS can alter the balance between excitatory and inhibitory signals in the central nervous system. This modulation then helps to recalibrate how the brain interprets pain signals, potentially reducing the intensity of pain experienced. This can facilitate long-term changes in how pain is processed, potentially leading to sustained pain relief even after treatment has ended. Meta-analysis indicate a moderate effect size suggesting that tDCS may benefit specific patient populations, particularly those with neuropathic pain or fibromyalgia. While some studies have shown significant reductions in pain intensity with tDCS, other sources reported minimal or no effects highlighting the variability in positive outcomes, leading to the gaps in existing knowledge. Gaps in existing knowledge would include heterogeneity of studies that show variability in protocols leading to inconsistent findings. The body of research on tDCS reveals significant variability in study designs, protocols, and methodologies. This heterogeneity can lead to inconsistent findings regarding both stimulation parameters with differences in current intensities and the outcome measures, as there is variability in how pain relief and other outcomes have been assessed, as well as mechanistic understanding. The need for more research on how tDCS interacts with different neurotransmitter systems and pain pathways. As tDCS is known for modulating neuronal activity, there is a significant gap in understanding the precise mechanisms involved. For suggestions in future research, a standardized protocol using the development of uniform guidelines for tDCS application in chronic pain is needed. By establishing a standardized protocol for TDS application in chronic pain by defining the stimulation parameters, have consistency across the majority of studies on tDCS, as well as having set outcome standards to create a more unified framework for assessing outcomes. Longitudinal studies investigating the long-term effects for tDCS on pain and functionality, by including longitudinal studies to evaluate the sustained efficacy of tDCS on pain and functionality over extended periods by using follow-up assessments as well as predictive factors. In conclusion, tDCS represents a significant advancement in the management of chronic pain within recent years. The treatment's capacity to modulate neuronal activity and integrating it with multidisciplinary treatment frameworks, the treatment can move further towards a more effective and personalized chronic pain management strategy. While tDCS is a promising strategy in helping manage chronic pain, there is continuing exploration needed in the field for maximizing the benefits of tDCS and the improvement in life for patients with chronic pain. Thank you so much for listening.